Hello, everyone. Tonight, I have instructed everyone here to look serious and to act serious because this is a subject that affects people's lives and we may leave a permanent impression on how they work. Well, we're talking about cheerleading and motivation mentoring. It may seem like a fun way to show your enthusiasm, and when done appropriately, can make a wonderful difference in the way someone learns and feels confidently about doing their job. Some people define cheerleading and mentoring in different ways. Some take a more supportive approach to it, while others take a very structured technical approach to it. Either way, cheerleading and mentoring is a way to transform our industry into something more stable, necessary, and respectable. Not that it isn't respectable already. Tonight, we have 61 panelists here to discuss this topic. Wait, is that right? No, we have five people. Five. There are only five people here. But these 61 people,
John, there's five of us.
Five people who are just a small fraction of the truly supportive and knowledgeable people out there in social media willing to give you a boost upwards. So tonight, we have
Five.
five panelists.
There
We
we
have
go.
Caitlin Brack of the a Baptist deaconess in the Indiana, Kentucky, Ohio area, who is known for her supportive presentations about networking and goal coaching. Kimberly I forgot Banners.
Hey.
And then we have Kimberly Jolivet Williams, who is an AAPC fellow from Texas Health Physicians Group and JMCI. I think that's Jolivet Medical Coding Institute, is known for her efforts in supporting coding students and from coaching her technical coding skills. Lindsay Motter, who was scheduled, unfortunately couldn't join us tonight, but we'll even have her on a later date. And she is the educational officer of the Harrisburg, PA local chapter, and is an avid social media prowling cheerleader. Next, we have Barbara Shaw. Barbara Shaw is a CDI specialist at Wellvana Health and frequently offers education through local chapters on specialty medicine subjects like OBGYN, hematology, oncology, and she, like the rest of us, is very supportive of newly credentialed coders on social media. Lastly is Bobette Haley. She is a revenue integrity analyst at Duke Health and is also very active on social media responding to coding questions. And she is a team lead in her facility, and so she's used to kind of taking new coders under their wings. And from what I hear from Bobette is Barbara's go-to person if she has any questions. So this is the kind of community where whether or not you're experienced or you're new, there's always somebody that you can go to. And we're here to talk about that. So let's start at the beginning with a basic question. So in each of your opinions, what is cheerleading or whatever term you find somewhere, and what is mentoring? Let's start with Caitlin.
So I think one of the big differences between cheerleading and mentoring is cheerleading from my perspective is it's more of like the social aspect. You could cheer on anyone. So it's more of the active involvement in anyone who comes across your feed. That's kind of my intake. Whereas like a mentor, like from a mentoring perspective, a lot of that it's more of an intimate relationship. So it's more of a relationship that you're kind of building on versus cheerleading is more for everyone that you come in contact with. A mentorship is a very specific type of role and a very specific type of relationship. That's kind of my take on that.
Let's go down the line. Barbara Shaw.
Well, I can echo basically what Caitlin said. I think when it comes to mentoring is that you're supporting the learning and helping develop that person into that role or what they're trying to achieve.
And we all have goals. We all have places we want to be. And there's always someone out there for that. Kimberly Jolivet Williams, AAPC fellow, you're up.
Yes, and I actually was about to say the same thing that when I think of mentoring, I think of it as an action, right? Because the whole reason that I am partnering with you is to get your goals, see what your desire is, where you're trying to get to, and help foster you to get to that. I'm a cheerleader every day in life. You all know, if you know me, I encourage, motivate, persuade, influence. That's just what I do. So when I think of cheerleading, of course, that's what we're going to do. And that's what we champion and do that every single day, just in our day to day of coaching people. But when I think of mentoring, I think there's a plan, there's a goal, there's something that that person's trying to achieve. And I'm going to line up and partner with them to make that happen for success.
Well, rounding out, Bobette, what is your take on cheerleading and mentoring?
Well, I echo what everybody else has said, but it's and I like Kimberly just said, we all do it every day. We're giving people, that like you've got this kind of feedback because everybody's having bad days
Yes.
from time to time. So I find, at least with what I'm doing, I'm kind of there just saying, you've got this and let me help you out. Mentoring, on the other hand, is when, as Caitlin said, you have that more one on one relationship. You're sharing your experience, your insight. You've set goals, you communicate, you're having regular time with them. I think there's that difference as well.
And I feel the same way. I mean, I consider myself a coding cheerleader because I'm always out there giving motivational, like, yeah, congratulations on the new role. What's the next step? So I combine the two, cheerleading and kind of like, okay, so now you you've crossed one barrier, or you've overcome one obstacle. Well, what's next on the list? So I see that in social media, there's a lot of this, and I truly love that. I see that everybody out there is very good on the cheerleading, and sometimes we but that's where we stop. So like I see that there's a need for mentorship. There's a lot of cheerleading, a lot of people saying, "Yeah, good job, congratulations," and then and then there's a lot of silence. But there's more we can do beyond that. So like I think the mentoring is like the next stage beyond cheerleading. And they go hand in hand. You cheerlead and you mentor. Like if you're somebody that can coach and you can provide guidance along their path a little further than just a motivational push, do it. I think that's what's best for the industry itself. Like we are a very tight knit community, very small, very not misunderstood, but I think like we are so small that we kind of have to help each other out, and that's where the mentoring comes into place. And I think I still ask a lot of questions to a lot of different coders because there's a lot I don't know. I'm basically your niche into one area, and I need to know a lot more than I do. So sometimes we do have to reach out to others to like fill no our need. So what is the best way to cheerlead or whatever you would call it someone, and what are the wrong ways to cheerlead? Let's start backwards with Babette.
Uh, I think just as far as cheerleading goes, is being positive, but being honest. I'm not going to cheerlead somebody and not be honest about it because Barbara knows me. I mean, I'm never going to say anything out of malice, but I think you can cheerlead somebody, but still be very honest and get them to have that confidence in themselves. And but if all you ever do is give negative feedback, obviously that's really not what we're shooting for there. So that's one of the ways I would not go about cheerleading. You got to give good with the bad, but there's a very positive way to do that.
Mm-hmm.
Kimberly, you on deck.
Yes, I think I agree. Also, I think one of the things that I know I struggle with a lot of times, and I'm trying to get better about it, is pausing, focusing, and listening. Right.
Yeah.
I think when we're doing that, we need to have uninterrupted, not waiting to get our words in, listening. Just try to clear my mind, not focus on anything, but looking at the person I'm talking to, Zoom face to face, right on my Zoom, and try to listen and understand what they're needing. Because I think sometimes I know I've been guilty of it. I'll get what I think I know, what I've been through, my experiences, and they're talking and telling me what they need, but I'm already ready, right? Because I already know she said 2 words, I already know what she needs. I'm ready to go. Not fully listening to what it is that the person needs. So when I think about that, I say let's pause, listen, and also set expectations because I think sometimes you may have a certain expectation that I can meet with you for 6 hours, Monday through Friday, 7 days a week. And I can't do that, right? So I do think expectations and getting a clear understanding of what you can give, what I can give, what that exchange is going to be so we can reciprocate that. I think that's another good point that when you're mentor, you want to make sure you do that. So no one's disappointed, right? Because the last thing I ever want is to set up to mentor someone and they walk away sad and disappointed and even more let down than they were before they came to me. That's the whole separate goal. I don't want that, right? So I want to set that expectation so everybody is clear.
How about you, Barbara?
Um, I totally agree with what Kimberly said as far as listening, because I find that a lot of times when I'm doing chapter presentations or if I'm presenting, if it's a state conference or what have you, and someone might have an interest maybe in something I did or a specific specialty, or they're thinking about bridging from coding to auditing, and so it's like you have to turn everything off and listen to what they're telling you, so then I understand exactly what they're wanting, so I can be very intentional if I'm going to partner with them. And I'm a I have a very high work ethic. So I expect that if I'm going to stop and listen and we're going to come together, I want to see them putting forth that effort, and we'll come up with the great goals that they want, or at least I can lead them. I've had so many people that will reach out to me that are getting ready to take, a test or a specialty exam or something like that, and I'll help them. I'm not going to give them the answers, but I'll help them. I do that. I just had a gentleman over the weekend that inboxed me saying how he wants to be a coder. He's trying to get books and study. And so then he was telling me it was a budgeting thing. And I told him that pretty soon the 2024 books will be discounted as we're starting to really roll out with the 2025s, and that if I come across someone that maybe has the 2024s on sale, I will, reply to him again on the inbox message. But I'm the kind of person, you give a great effort, I'll give great effort too. I can't do it many hours, but I'll do the best I can. But at least, help, kind of like what everybody else would do too.
And rounding this out is going to be Caitlin Brack.
So I agree with the perspective so far. I think you have to, especially going back to what Bobette said earlier, you have to be able to balance the good comments with the bad. They say that it takes 10 positive statements to counteract one negative. So I think as far as what is the best way or what's a wrong way to cheerlead, I don't want to say that there's a right or a wrong way, because there's over 7 billion people in the world. There's more than one right way to do something. But I think it's learning how to frame the constructive criticism as, okay, this is not where you're lacking. This is a growth opportunity. Okay, so this may not be your strong suit. That's fine. How can we do that? So it's wording it. It's changing the way that we say things and the way that we think about things, as it's not where I'm falling short. It's where I can learn. It's where I can grow. So I think it's changing how we say things. There's a right or wrong way to say something. I don't think there's a right or wrong way to cheerlead. There's a right and a wrong way to word something. And I've said things incorrect. I've said things in the wrong way, and I look back and I'm just like, okay, I think I could have said that better. I think I could have said that differently.
Yes.
I think we all have those moments.
Mhm.
But I think, again, when you reflect back on conversations, it's okay, I could have said this better. And it could be even going back, hey, this is how I said it. I didn't really mean to say it this way. Let me try again. And recognizing when you say something the way that you shouldn't have, and being able to own up to, okay, that's not what I meant to do. I think that's being an adult, being able to say, hey, I was not, I didn't say that the way that I wanted to. But I think, specifically with cheerleading, I think a lot of the things that we've kind of talked about has been more focused into the mentoring on, like, on the guidance piece. Because I feel like, again, cheerleading is more of the, more of the consistent on how we say things on a surface level versus that deep dive into what a specific purpose is of a relationship.
Good answer. And from personal experience, how I see it is like, you can cheerlead and you give motivational advice within reason. I deal with cardiology a lot, and I deal a lot with interventional radiology, and I have a lot of people that say that I want to take that deep dive into interventional radiology. I said that's great. It's a great field to be in. There's a high need, but it's a lot of work. I'm not going to lie to you. This is like the marathon of coding. So reasonable expectations, like, you want to motivate, but you let them know that, hey, by the way, as long as you're willing to do it, we're going to be there for you. And that's one of the things that I try to set, set your, sights on something, but we want to do it realistically. So that's how I try to approach it. I do see a lot of on LinkedIn and on social media is like people says, I want to do this. I'm ready to take the exam. I'm ready. And then there's a lot of negative comments, like, we see a lot that there's not jobs, most people hate it. And how do you respond to that and still, motivate people without saying, just disregard the negative stuff because it's not true. But there might be some truth to certain aspects. But that's something that we take into account. Somebody might have a point that sometimes it's hard, but it's not a dead end. So, like, there's ways around that, and explaining this. Sometimes there is a lot of negativity out there about this field, but like everyone said, you take the good, you take the bad, you take the rest, and there you have it. It's just a fact of life.
I love that song, by the way, and that show. But I totally agree. I totally agree. I'm being an educator. I teach the AAPC VILT program, and I teach for Houston College and taught for Dallas many years. And students will always say that, John. It's amazing that you bring that up because that's the first thing they'll say. They're like, I'm in this Facebook group, and everybody is saying it's too hard to get a job, and it's this and that. And I always tell them, you don't know what their process was. You could be listening to someone that applied one place every 12 months. You don't know who you're dealing with. This is random people who are venting on social media. So I tell them everybody's plot, everybody's plight is not the same. And even in mentoring, I constantly say, you're unique, right? What even works for another student that I mentored, it may not work for you, right? I was born and raised in Opelousas, Louisiana. Y'all know I call myself a Raging Cajun Leo. My upbringing was probably totally different, right? From a lot of other people. There's just certain things that come with being from Louisiana. And so, you grow up with tough skin. Things that normally would offend you probably don't because, hey, that's just how they are. They shoot it straight from the hip. And so I tell people, consider who you're dealing with. Also, and that's even when you're mentoring or if you're a mentee, because even in cultural differences, right? There's so much diversity and the way people perceive things, how you talk to them and how they take it in, it could be totally wrong just because of how you're delivering it, or how they're receiving it. And you got to have those conversations. But I always tell them, consider your source. Don't think that your experience, your example, everything that they're dealing with is going to be yours. That could totally be false because I have students that go through programs. There are people that as soon as they get certified, before they get certified, they got a job. There you just don't see those positive stories as much as you see the negative. So you have to be mindful of that stuff.
All right, so let's go on to mentoring. Now, there was a question posed in our chat, which is a nice, segue into what we're talking about. Christy Hunter said, what do we do to go about getting a mentor? I'm a coding student studying for the CCS and RHIT who could use someone to turn to for those hard to solve problems. And that's a good question. Like, we want to discuss what the process is regarding mentoring and how should someone go out about finding a mentor that's well suited to them. Let's start in the middle with Barbara and work counterclockwise. Barbara, what do you feel about that?
Well, I can say that previously, when I was on the coding integrity team with Bobette Haley, we at Duke had a mentor program, and it was for the medical coder trainees, Coder One trainees, and it was put them into place to get them to a medical coder 2. And so we would take turns when the manager was off and do that. I found a lot of times I was doing it, a fair amount, but I enjoyed it. Basically, like I said before, not to be a broken record, but I listened a lot. I listened a lot to what the students would say. If they were saying, I'm looking for someone that can help me because I'd really love to be an ophthalmology coder. And what I would say to them as they were studying for, they all had their CPCs, but they were wanting to bridge into that specialty. And I would say, well, ophthalmology is not my specialty, but I'll help you as you're going along. And, I can get into the CPT book, and help you that way, segue into it. And if it was something that that I was fluent with, I would definitely say, oh, okay, let's do this, and we could do more things for those specialty type things to help them to get to where they're wanting to be. In regards to this lady's great question, by all means, there are people that want to mentor. They enjoy doing that. And I was a previous practice administrator. I would hire, say, medical assistants or nurses that did not have the specialty that I worked in. And they might have experience in orthopedics. And I was in this OBGYN practice. And I would say to them, I can see that you're a great medical assistant or you're an RN or an LPN, you have many years of experience. And if you want to learn about OBGYN, plant your feet here for a good year or two, learn the basics and figure out if you want to specialize in this and learn more, stay here and grow with me. But if you find after a year or two, this isn't the specialty for you, by all means, you've gained that knowledge and you can go on and build more, because I know that we can all say that we're still learning. I'm learning every single day, and never at this age, after 39 years in healthcare, that I would still be learning. I never, ever imagined. So there's so much to learn. And like this young lady's working on her CCS and her RHIT. I do not have those credentials. However, if it's something where the modalities or the modules she's working on that I can help with, I'll definitely, we'll see what we can do. But I think that if you're wanting those specific credentials, you might want some people or a person or a mentor that has that can help them. I can help get that person channeled in the right direction, and then reach out to some of my other friends that have these credentials that might be a better resource than I am. But I would definitely do what I agreed to do as best as I can.
All right, Bobette, you wanna lead it into your response to that, because I see that you two work close together in the same kind of like
Right.
some kind of dynamic.
I would, as Barbara said, I would help as much as I could, but I would also, I'm not sure if AHEMA has a program, or you could reach out to somebody at AHEMA. I'm just directly thinking of her question, that they may be able to connect you with somebody that could mentor you. Otherwise, like Barbara said, I do know people with AHEMA credentials, and I would reach out to them and see if they would be willing to, help her out and mentor and do what they could with her. Because even though it's coding, I know people say coding is coding, AHEMA and AAPC aren't exactly the same when you're sitting for your test. So it's good to have somebody who's gone through that AHEMA process. So I would definitely want to connect her with somebody, but I would help as much as I could, as Barbara said, because our program at Duke was set up very differently, that you came in at a certain level, but also back in our QA days when Barbara and I were both in QA, when we brought on new employees, we would also mentor new employees for 90 days. They would sit with different people because we all had different specialties that we audited. So that we mentored through that time too.
Well, Kimberly, let's move on to you. And I see, Kimberly, that you actually put something in the chat bar. But what is your response about finding a mentor?
Yes. So my first and foremost is, are you on LinkedIn? And do you have a LinkedIn profile? I hope that you do, because the great thing about LinkedIn is you can literally go and search CCS or RHIA, and all the individuals that have that credential on their profile, which there are gazillions, okay? You can see, is anyone an educator? If you find someone that's an educator, 9 times out of 10, they'll be willing to support you and help you, because that's just what we do. We love to share, support, and help. The second recommendation is AAPC. If you're connected to AAPC, they have a membership program. I am signed up as a mentor. I know several other people that are signed up as a mentor. And even though CCS, right, that's the AHEMA credential, AAPC have people that do inpatient coding as well. And they may be able to help you, although it's not for the CCS, they may be able to give you some tips as a mentor for the CIC or an inpatient facility credential. So that would be my Kimberlyism recommendations on that.
Okay. Caitlin.
So I'm gonna echo with what a lot of the what the lady said beforehand. Make sure whenever you're looking for a mentor, make sure they have already been where you want to go. Like I'm sure I could probably, just like Barbara said, I can look at guidelines. I know the basic coding things. I can help on that aspect of it. But as far as what is specifically going to be on those exams, you want to find someone who has already been where you want to go. I want to echo what Kimberly said. Make sure you have a LinkedIn account. You can meet so many different people. And I think the difference between networking on Facebook versus LinkedIn is Facebook, you're going to see all of the negative stuff, which is what impacts so many people as far as getting jobs or not, because they don't carry themselves professionally even on their personal pages. Employers look at that. So when you switch your shift over to LinkedIn, it's more of a positive area. You're going to see a few grievances everywhere, but you're going to find more of a positive, and you're going to find more of a support system, more of a better, you're going to have better pickings over there. Is what we used to. I'm from Eastern Kentucky. We say go where your better pickings are. So you're going to have better pickings over there. But and another thing that I want to suggest is go to industry events, go to conferences, go to retreats, because those are the people who are serious about the field, who put a lot of, if they're going out of their way to meet other people. Like for AAPC, we have chapter events. I know AHEMA, they have like statewide.
They have their
you know,
conferences.
yeah, they have statewide. I don't know if they're called chapters or what they're called as far as that goes, but because I've spoke at several of the AHEMA conferences and stuff over the years, and so go where those people are. But again, obviously you have a LinkedIn account because you're here, but but use it. I honestly, my career did not propel until I started being active on LinkedIn, as far as being more of a contributor you know with authoritative sources and things. I started learning more resources that I had available to me. So go where the people are, wherever that is. Whatever, if you want to DM me separately and let me know like what state you're in, I can kind of help you find some of those people, because I have several of them in my contacts. So I would be more than happy to help you. Goodness. too many H's. I'd be more than happy to help you find someone who could be a really good mentor for you and kind of give you that guidance that you need.
Yeah. And I like to add on to that. So if you're on social media and you know what you want to do, we have these presentations that we do every week here where we aim to discuss each individual kind of coding field, pulmonary, cardio, physical therapy. There's so many different aspects of kinds of roles you can do. But once you determine what your niche is and where you want to aim to be, there are a ton of people on LinkedIn that are already in that role. If you just do a search or you enter, you propose, I'm looking for somebody that knows somebody that is coding hematology. You get hundreds of responses, maybe not 100, but you'll get a lot of responses. Or if you're on Facebook, there are a lot of Facebook groups, geared toward different types of coding, general surgery, hematology, compliance. There's a lot of things. There was a statement that one of our people in the chat put on here that Dumbledore is planning to take the CCS at the end of the month, and she's really having a hard time with regulations. Well, there's a lot of compliance people out there that would be able to assist you. Just know where to look. So there's a lot of chat groups and there's a lot of Facebook groups related to these topics. So knowing what you need to
Backwards.
Oh, wait, are we pointing people? And who are we pointing down to? Is that the I'm sorry. Yeah.
Kimberly, am I pointing right? Is it backwards?
No, you're
Absolutely.
pointing right.
Absolutely. And also know who your authoritative resource is to get the information. Because just so you know, if you go and pull up OIG on YouTube, oh my God, there is a gazillion videos on regulatory information. There's an intro one to the top 5 laws. I mean, there's so many. So you have to dig and do your little research so you know who to go to. I'm a big proponent about authoritative resources. Now, when you go to YouTube University, they're going to have a gazillion resources. You want to stick to your authoritative resources, okay?
Right.
Like OIG, because I don't know the rest of those people. So I don't know how accurate that information is. And remember, they're just like you and I. It's your onus to make sure it's correct. So I stick to authoritative resources. That's just my Kimberlyism preference. But yes, you can go to Google University, YouTube University, but you also can contact me and I will help you as best I can with those regulatories.
Right.
Christine Hall done a really good. She done a really good segment on the compliance, the seven recommendations for a compliance program.
That's right.
She did a really good segment on that.
Yes, and Christine Hall, she does have phenomenal resources on all things compliance as well. And especially when it comes to those regulatories. And there's so many others, yes. Mm-hmm.
Now, when Bobette and I worked together and we were compliance specialists at Duke on the same team, when we were doing our audits and if whatever authoritative resources we used, they were authoritative. We could not use Coding Clinic or CPT Assistant. I mean, it was that and that's it. And I think that's why when we do things, even when we collaborate with each other, we look at it as at a compliant stance. And even when I do my own chart reviews, I do my audits, it's that compliance. It's putting all those layers on top of it. And it's like, so when someone talks to me, they're like, oh God, she's not direct, sometimes. And it's like, well, there's the coding, there's the auditing, there's the compliance, and then you got billing revenue. It's like, so it's sometimes I feel like I have ADD where I'm like, okay, what are we talking about? Okay. All right. Well, okay. From a standpoint, it's this. From auditing, it's that, and billing. And don't forget, if they're coming in for the annual and they got this and they got that insurance. So,
Barbara, I am the same. I'm the same. I will talk to myself, right? And I will say, okay, Kimberly, turn off the coding brain. You're in compliance. You got to turn that brain off. Put on your compliance hat, because we know it has nothing to do with the coding as far as mitigating that risk. So I have to talk to myself. So I totally get what you're saying. Totally.
I laugh because I do the same thing, Kimberly. That's why I'm over here chuckling so much.
So, as a mentor, if you decide to take on a mentee, so how should a new mentor handle a new mentee, and what is the best way for both of those parties to be successful? Let's start with Caitlin.
So I think kind of separating that out before deciding to be a mentor, you need to make sure that you're up for it. That everybody's at the end of the day they're coming to you for a need to be met, and you need to assess if you can adequately do that. So you need to assess what the can you give to them what they need within an acceptable time frame? Does that make can you guys agree on how much time to spend setting boundaries? How long are your sessions going to be? How often? How do you want to handle cancellations? I think unmet expectations, I think that ruins any kind of relationship quicker than anything. So making sure that those expectations are clear and making sure that everyone understands their role. Like the mentee, they are meant to drive this relationship. The mentor can kind of guide them in their thought process on, how they decide to learn those things. But the mentee needs to be able to drive that, and they need to have they need to know what they need out of that relationship. So I was whenever Ray Marie Jimenez, she started mentoring me, I met with her and I said, okay, what do I need to do better? What do I need to learn? And she said, I can't tell you that. And I didn't understand. I was like, what do you mean? Like, you know what we need. So I used to work at AAPC during this time period, and she would say, hey, she's like, I need to know where you want to go, and then I can help you from there. And that's what you have to keep that in mind whenever as a mentor, we love to tell people what to do. I love doing it. I love saying, go do this because I said so. And I had one of those, and she'd be like, I understand why you're telling me what to do, but okay, I'll go do it. And then she was like, I'm so glad you told me to do that. And now that I step back, I'm like, okay, I shouldn't have done that. That's one of those things where I'm like, I should have told her how to do it differently. I shouldn't have just said, go do it. But as it's understanding what your role is, and everybody's role is in that relationship. Okay, I'm supposed to give them guidance. I'm supposed to give them the tools to know how to go, what direction they need to go into next. I can, it's not expected that I help with employment, but I might be able to give them leads. I might be able to put in a good word for them because we now have this professional relationship. I think a big missing piece that we see in mentorship is because the dynamic, the purpose of the relationship is professional. People forget to be personal at times. You can only get so far if you're building a relationship. You can only get so far just talking about industry. You have to be able to get to know that person, and you have to be able to give part of yourself without any kind of expectation in return. They have to know that you're being authentic. They have to get to know you in order for that relationship to grow. So I think that's a big part of whenever you start mentorship, the things that you need to keep in mind, and from a mentee perspective, what you need to excuse me, what you need to what you need to expect on both of those sides.
How about you, Kimberly? Let's go counterclockwise.
So I agree with everything that Caitlin said. I do too want to say communication. You have to communicate. I know sometimes when you get into relationships, everyone think they know, right? And you assume and you think that you understood, and you have a clarifying question that you feel you want to ask, but for whatever reason you feel you don't want to ask, right? And you don't ask, and you can, even from a mentor or a mentee standpoint, you'll be going totally down the wrong direction because you didn't do the clarifying question. There were lack of communication. And so I think setting those boundaries, also making clear, again, listening and getting those goals. What are you trying to accomplish? Because it's my goal to help you grow and get the growth you need to accomplish that goal. So I need to be crystal clear on what that is and not clear as mud, right? Because otherwise we'll get nowhere. And the worst thing is for you to feel worse than you did before you started. So you want to make sure you have an open line of communication and then establish how you want that to be. Because like me, I am not a texter. If you start sending me a bunch of texts, I'm going to turn my phone on silent, right? So if you prefer emails like me, where I can read it, I can see, get your thought, go analyze it, then send you some resources, say, I prefer things in email, right? All of that stuff matters. Communicate well. How do you like communications? How are you with your emails? Because that's another thing as a mentor. If I'm sending you all these emails and you're never even looking at it, you're like, oh, my email's full and it's been kicking back everybody. Well, now I feel like I've wasted my time. And now that's an unspoken frustration that we could have ironed out in the beginning had we had good communication. So I just think good communication, set those boundaries, know what methods work for everybody, and that will make things flow a lot seamlessly.
How about you, Babette?
I would agree with everything that's being said. I also think, for me personally, I always put patience in there for myself and the person, the mentee. We both need to have patience because I may think we're further along than we really are, and I may be impatient and trying to push things a little bit,
That's a
or
good one.
vice versa, that the other person's like, oh, I thought we were way over here and you're way over there. What's going on? Let's move, let's go. So, but again, that also comes back to having very clear, open, honest communication so that we're all on the same page. But I mean, everything that's being said is so valuable when you're setting it up to have everything be clear and
Yes.
building that trust and respect so that they know they can ask you
That's right.
questions and you can have that relationship where they're not afraid to ask. Because I have been in situations where I've had a mentor or somebody that was, not an official mentor, but was training you for something. And you're like, I don't think I better not ask that question. Let me see who else I might be able to go to for that one. So I think that everything that's being said, I totally agree with.
Mhm.
How about you, Barbara?
I can only echo everything that's been said. I think when you are establishing that relationship as being the mentor with that mentee is finding out exactly what it is that they're wanting or they think that they want to achieve. And I'm the kind of person where I have a high work ethic. So I start my mornings 5 in the morning and I'm going and I'm going. And then when the end of the day, I've done my thing. And then if I'm not doing a CPC chapter meeting or something like that, and I try and curtail that so I can do some mentor type things. But I expect that action is going to come from both of us. So we're going to, definitely, figure out what we want, what the end goal is, and go from there. So if it's something where I say, hey, let's review the guidelines, on chapter 5 or something like that, and then we regroup whenever it is, and they haven't looked at.
Yeah. And I also agree with the laws of. I do want to add that I cannot stress enough setting reasonable goals. I
Mhm.
think that's an important thing. You then need to set, here's what I want to attain as the mentee, and the mentor will have to build some sort of plan as to how we're going to get you there. And that's something that both parties would need to figure out for it to
Mhm.
work. If there's no plan in place and there's no goals, I mean, you're just sitting, talking back and forth about random things constantly in circles, possibly. So, having clear goals, having a clear plan, and as well as the other things, communicating and being
Mhm.
professional. But I think having that kind of uh, open open pathway is very necessary. When you do go through other professional organizations for mentoring, such as the AAPC sponsors Mentor City, they have what they call, there's some kind of there's an agreement. Okay, there's a social agreement that they expect both parties to sign. That you're going to be respectful, you're going to be timely, you're going to give information as to the most accurate information, and there's going to be a lot of responsibility. So, what are some other social contracts and social agreements that you'll see between a mentor and a mentee that kind of have to happen? How about you, Kimberly? What are some things that you think that need to be like laid out in the beginning?
Oh, yes, definitely. And I love the concept of the social agreement, right? Because I think right off, that's the first thing you want to do is one, how much time can both of us have, right? Because what I don't want is to set an hour aside and you're like, oh, on Tuesday every night, my son had football practice. I only got 15 minutes, right? You need to know those things because each person wants to, you want to make sure you're respectful of each other's time, right? Because the mentor wants to be there for you, but the mentee also wants to be there to receive. So that good exchange. Also lining up what the goals are, because I don't want to be preparing to make you a biller if your goal is to be a coder, right? I don't want to be giving you compliance and your goal is to be an auditor. Like, and maybe it's not even those things, but set what the goals are. In addition to that, I already said, can we communicate? Do you like to be on Zoom? I have a sister. The worst thing you can do to her is put her on a Zoom, having to be face to face with people. She does not. She's like, no cameras, no. And so, are you that type of person? Some people are like that. They don't want to be on camera. So, would you rather us get on the phone? Maybe if we're in the same city, do you want to meet up at a Starbucks? Because some people, I know me, I yearn sometimes for in person, right? I was just telling my chapter members that I'm so ready to have our in person chapter meeting with my local chapter. I'm about to pop because we've been doing virtual so long. So just setting up those things, I would say, and how long are you going to meet? What are your goals? How should we meet? And then knowing that person's receptiveness, because I know one of the things that was always a barrier for me, again, I used to have a great administrator and she used to always say, Kimberly, we can't think that everybody knows or thinks or respond like we do, because when we do that, we set ourselves up for disappointment, because now I have the expectation of you to do things the way I would do it and you don't even know how to do that, right? You have not walked that same experience. So that's my Kimberlyisms on it.
Let's go to Babette.
Kimberly, I love what you just said because there's recently a situation where I was saying something very similar because you can't be doing something for so long and it fits this with a mentee that you just think, okay, they know this, and you're like, well, why are you doing it that way in your head? Because you know how you would do it, and you're 100% right. It's not every situation is going to fit what you would do. I agree. Kimberly hit the nail on the head with that. It's setting those expectations and moving forward with those things. So I mean, there's no sense in repeating anything because that's really what it comes down to, is setting the expectations, having the goals, knowing your schedules, and just being able to move forward with that and respecting each other's times. I mean, that's so important for that to work.
Yeah.
How about Caitlin? We'll change up a little bit. Caitlin, and then we'll hop right into Barbara.
I think something you have to consider when you talk about the social agreement for a mentoring relationship is this a mentoring relationship that's being set on your time, on your terms, versus a work versus like an employee, like your supervisor to employee? Because a lot of the times in those dynamics, if it's your manager who's your mentor, you're on their time and you have to adapt, versus whenever you're doing it on the side, your personal time, it's a conscious effort, and you have to be conscious of, okay, I know if that person's giving me my time, I've got to be respectful and give them mine. So in addition to everything that Kimberly said, because I'm going to agree with Bobette, Kimberly hit the nail right on the head. I think sometimes you have to also be considerate of what is the reason behind the mentoring relationship. Is it because of Is it because of a job related reason, or is it something specifically of I want to learn a new skill, I want to learn a new I want to learn how to do I want advice on something. So is it career advice versus learning how to do something versus, okay, this is my job role. I have a set time frame where I'm expected to pick all this up. How do I do it in a way that stays within that time frame? How do I keep up those expectations that are set forth by my employer versus, well, I don't want to say they're a little bit more relaxed, but but again, on the personal side, where it's something you're doing out, do it out kind of outside of work specifically, how do you learn knowing how to set a boundary that's not being set for you? So I think that's a skill that's learned. I think it's an acquired skill, and a lot of the times we learn it from being in a leadership position. That's where I got a lot of my mentoring initially, but as I start to do it on a different level, where I'm taking on people who are newer into the industry, I'm learning how to set those time frames and how to advise based on those aspects.
Excellent. So we talked about social agreement, but what are some obstacles that might interfere with this mentor-mentee dynamic? Let's go back to that. Oh, sorry, Barbara, I completely cut you out of the mix. Well, back to the question at hand about the social agreements.
I mean, everybody said it, so well. I mean, the only thing I can say is just being respectful of everyone's time. I know even when I mentored, when I was a practice administrator, say I had a new coder and they were wanting to learn how to do surgical, coding. And what I would say to them, because I had a lot of tasks that I had to meet, I had to be productive and get my things done, was I would always say, my window of time to go to review your work, answer any questions was like, say 8 to 9 in the morning, then in the afternoon, 1 to 2, and then 4 to 5. I had like set times, and that was it. And I can remember sometimes people would come to me and I'm like, I understand, my thing is it, I have to have focused time to do certain things. So I think being respectful and knowing how important each person's time is, both parties' times are very important. Even if you're wanting to go see a play, someone asks you at the last minute to go see a play and you're supposed to have that time, let me know as soon as you can so I can change things, because I might change my dinner plans or not cut my grass, because I've got this session coming up. And I know in the summer, especially with the warmer months coming, we're all busy. But I think that's something to consider, along with what all the other ladies had to say as well.
And and that also varies from person to person. Like, for example, if me mentoring somebody and holding my time keeps me from having to cut the grass or fix stuff, I might just do that. You know what? Oh, she was here 45 minutes late. Guess I'll have to mow the lawn another time.
That's why I pay somebody to do it.
Me too.
I'm gonna tell you, I take great pride being the only woman in my neighborhood that does her yard. Now I do have a gentleman that weed eats and edges because I have rheumatoid arthritis. So but I do get on the mower and do the whole 9 yards though.
Oh, I have a girlfriend like you, Barbara, and she's the same way. She will get out there and mow that lawn like nothing. Me, I probably would be in the hospital with my asthma and allergies. So I leave it to the lawn service.
I feel your pain.
I don't like being outside. If I can see it through my window, that's fine.
That's me.
I'll go outside to say I've seen the sun, but I don't have to be outside.
That's me too.
Funny.
It's either too cold or too hot. I like to be inside. I can control my temperature. I'm comfortable.
Mine is the bugs. I don't like the bugs. I don't like things flying around me.
I don't like the outside.
Hey, obstacles. So I know I had posed this question before, but what are some obstacles that might interfere? We did talk about, scheduling conflicts and time, but what are some other things that might get in the way of a mentor-mentee dynamic?
I would say too, I go back to, I think it was Bobette said about patience. You want to give a little grace too, because I do think if you become, even as a mentor, right, you can micromanage, right? And you don't want to be so hovering or micromanaging someone when you're supposed to be being supportive of their growth. I think being a micromanager or just overbearing, that too could be an obstacle if you're not given enough grace to let the process work and flow through. Also, like everyone said, that miscommunication, um, false expectations, all of those things, I think, and even having a little empathy, right? Just because I'm late one time, don't think that every time I'm gonna be late, John, and you're gonna have to go cut your grass and make me wait 45 minutes. you know, life happen. I always say life be lifing, right? So just
Right.
because they're late one time, give a little grace. Hopefully the next session they won't be late.
I'm late to everything. You can 100%. I will not be on time. My friends tell me 30 minutes before they want me to be there. I'm not on time for anything. I I try, but I'm not. And I will be honest. If you want me to be
But
on
you
time,
got two
tell
little
me 30
kids.
minutes.
You got two
I
little kids. We're gonna give you some grace.
Yes.
I ask for grace. That's for sure. Kimberly, I'm going to say one of the biggest things that I've seen kill a mentoring relationship is incompatible personalities.
Oh,
Mm.
that's
Like
a good
I,
one.
I'm not everybody's cup of tea. I know that. I'm one of those people. You either like me or you really don't. I don't care either way. I'm not bothered, but I'm aware enough to know I'm not everybody's cup of
Right.
tea. So it's neurodiverse. Yes,
Yes.
I'm
Yes, Stephanie.
I'm aware. Not everyone likes my squirrely brain, or the fact when you can say something and I'm already five conversations ahead because that's what my brain did. I've had to walk people through my thought processes sometimes, and they don't like that.
Yeah.
I'm sorry, but again, I'm gonna say incompatible personalities is one of the biggest things I've seen hurt
I,
relationships.
I think too, one of the obstacles can be um, not being open, even though you're saying, I want to mentor, I want to learn, not being open to the feedback and taking it too personally. I
That's
think,
true.
you really have
Yeah.
to and as a mentor too, you have to say it in an appropriate way so that people don't
Mhm.
feel attacked. But, we've all been on the other side of that and getting feedback even in our jobs where people say something that at first you might be like, "Oh, well, hold on a second," and then you have to remember, you know what? Don't take it personally. This is to help you, and this is to help you grow.
Mhm.
And I think that sometimes that needs to be set up front, or otherwise it becomes a huge obstacle. And I
Mhm.
love, Caitlin, what you said about not being everybody's cup of tea.
I know,
That's
right?
100% me. I'm the
Yeah,
same way. So
me
I was like,
too.
oh, yes.
Yeah, I mean, some people they just even with me with my Louisiana Raging Cajun dialect. Sometimes that's too much for people. They're like, "You're too overwhelming. You like all these colors. I don't like colors. I like black, white, and brown." So I get it. Everyone is not for everybody, but that's why I say the business of healthcare arena is so big, but it's just so small. And that's why I say connect on LinkedIn. There is someone there for you. It may not be me. It may not be Babette. It may not be Barbara. I see she dropped off a little bit. It may not be Kate. It may not be John, but there is somebody. Don't give up. Find who you connect with, who you can resonate with to achieve your goals and partner with them. There's someone for everybody.
Yeah.
Sorry, I'm cackling at the chat. If you see me laughing, I'm not laughing at anything anybody's saying. I'm cackling at the chat. I don't know. I don't know if maybe John, you probably seen this too, but where there's a mismatch between a mentee's aptitude versus their attitude. If
Yeah.
they do,
Mm,
if we're not, we don't understand how to do these things by design. We have to
mm,
learn it. But there's a specific balance between, okay, if someone has the right attitude about something and they may not have that skill,
mhm,
you help give them the tools to learn it. If
mhm.
they may even know how to do what you want them to do. We probably see this more in like a work capacity, but if they don't have the right attitude,
Yes. Well,
It's one of those
I
things.
used to, oh, you hit on a good one, Kate. I used to say this all the time when I was a manager, a hiring manager and supervisor. I used to
Mhm.
tell my director all the time and my administrator, you give me somebody with a good attitude, I can teach them what I need them to know.
Uh-huh.
Attitude is everything. It's like I will take someone that did not know anything about coding, billing, revenue cycle, payment posting. If they have a superior attitude, they're a go-getter, they want to learn, they're right there in, I can teach them anything. Attitude is everything. You can
I've
teach
had
them a skill.
people, yeah, I've
Mhm.
had people where like they thought that, that they thought that they knew it all, and they would just, they would cut me at every opportunity that they got. And I got to the point where when I was talking to my supervisor also, I was like, give me somebody. I don't care if they're brand new. I would much rather have someone who is brand new, that has
Mhm.
a good attitude, that has
Mhm.
that doesn't think that they know it all, because if we know anything in
Mhm.
this industry, you don't know it all. It's nearly impossible. There's over 20 specialties. Then you have the auditing, the billing, the compliance, the you have so many different, there's no way to
And
ask.
just the changes. Things
Yeah,
change
the
so
changes
often.
alone.
Mhm.
Yeah.
You know what?
Yeah.
I would to add into that. So I've mentored I would say probably dozens of people over the last couple 3 or 4 years, and
Mhm.
one of the things that really kind of rubs me the wrong way is like if I'm given my time and my enthusiasm, and I can be very overly enthusiastic, and what I hate to deal with is
Really?
kind of combat a little bit. If there's some kind of combative negativity, like, oh, you know what, I'm never gonna learn this. You know,
Oh.
I hate hearing people say that. You know what? They get frustrated, and their first response is, "This isn't for me. I'm never going to learn this. I'm not good enough. I'm not strong enough. And God dong it, people don't like me."
Mm.
That kind of mentality kind of kills things. But sometimes you have to work through that. Sometimes people are having a bad day. But if you're
Mhm.
not able to tolerate, certain, kind of like personality traits.
Mhm.
Those are things you want to identify quickly. And
Yes.
I also want to mention earlier that sometimes it's hard finding a mentee, because of people click. There's going to be some certain biases out there. Some
Yeah.
people want to be mentored by certain people. Like
Mhm.
as a dude, like if I'm going to reach out to Caitlin and say, Caitlin, can you mentor me? And she ghosts me, like doesn't want to respond. Don't push the issue because there may be another reason why she doesn't want to talk to you and do that out of the blue. It's like, hey, mentor me. You know, there's like so like again, soft approach. There might be some ways that you know that you could kind of like test the water first, because again, it's not everybody wants to be a mentor. Until you find the person. Uh, kind of like open up your horizons and speak to a few people until you find somebody that's willing and able to do
Mhm.
this. Not
Yeah.
everybody has time. Not everybody feels that they have the um they're not confident with their own abilities.
Mhm.
Sometimes that's also kind of an end, because if they're not able to give you the information they need, yeah, it's not going to work. So
Mhm.
again, these are the obstacles we're going to you're going to hit.
Yeah.
Eventually
I
you will.
love I don't know if you saw Stephanie's comment, John. I love that. Whether you believe you can or you can't, then you're right, because it's what you believe about yourself. So, we are our encouragement. Like I tell people all the time, you have to encourage yourself. Whatever you believe about yourself, then yes, you are right, because you're the one believing it about what your efforts are. I love that.
Yeah.
Well, it's one
And
of
I
those
like
things
Christy's
like,
response too. Christy's
Huh?
response to that.
Yes, positivity is huge. Yes, in this business, it is. And anybody that knows me, hey Barb, she's back.
hey,
I said
Barb.
anybody that knows me knows. Yes, I'm gonna encourage you. I'm gonna be positive. I'm gonna give you that light up of fire, because we have enough negativity around us. You all, we need to be kind, loving, nice. Like in Dwayne Johnson's words, it's nice to be important, but it's more important to be nice.
Oh, I like that.
I like that.
That's the rock.
Well, we have Barbara back. She might have had some internet issues, which happens from time to time. So, Barbara, we were talking about some obstacles to a good mentor-mentee relationship. What is your take on that?
Well, first off, I'll let y'all know that I do have two internets, and so I picked the one, and then I had to go to the other one. What are some issues between the mentee and the mentor relationship? Was that the question?
Yeah, some obstacles that might interfere with like that whole dynamic.
Obstacles? Well, I mean, sometimes people might have a there's time issues if you have your job and you're studying and you have children, or you might have a husband or your significant other. So those are some things. And then sometimes as you're going through, if you're studying for the CPC or something specific for a different type of credential, where you might kind of get stuck on something. Like, for instance, I would get stuck on orthopedics or cardiology. I might have to read it like 2 or 3 times. And so those can be issues. I know there's certain things with myself, like I can learn from lectures, I can learn from reading and diagrams. And sometimes when I'm trying to learn something that just isn't digesting with me, where I might need someone to instruct me on it, and that's okay. So those can be things like that. I know if I get hung up on something, I go to someone to have them explain it to me, to help me, as someone can have that extra time to go over that with me. So sometimes you have those type of things.
Oh, and that was a great one you hit on, Barb. I almost forgot about that. Know your learning style. I think that's another great one as well.
Yes.
I'm so glad you said that, Barb, because if you and your mentee don't understand how you learn and what best method you learn, I'll be sending you all these audio files and videos and it doesn't work. Maybe you need a PowerPoint, or maybe you need a Word document where it's bullet size. That is a great one. I'm glad you brought that up.
Yes.
Thanks. I know that when sometimes I do a chapter presentation, I might have, on the slide, information, but then I'm also putting in charts, because for those visual learners, so you put it up there. So I have done that because I know sometimes I can read it and digest it, but then sometimes I need that visual.
That's right. That is a great one.
All right, so here's an interesting question. So where can a mentor learn to properly mentor somebody? I know we talked about Mentor City, but is there any other good sources of teaching techniques that somebody can pick up on?
There used to be, Caitlin used to run a networking group. And I think there's some other ones out there. You might search and see. If not, that may be something maybe you can lead up, right? Create a group where people can join, and how to strengthen others in either being good mentors. I mean, I think that's a great idea, but I would say link up. That's my number one, is link up with someone who is a mentor, and see if they will take you along and guide you and show you the ropes, right? Or be the one that says, hey, I want to learn how to be a mentor. How many mentors will join me on a Zoom 5:00 on Wednesday, right? You'll be surprised how many people may join you, and you can get guidance that way.
I want to say, I think you're gonna. I think this goes with just about anything. You model what you learn. I think there's so many people who are afraid of the term mentorship because we've coined it as professional only, but mentoring is just giving guidance.
Oh yeah.
It's we give our I don't know about you, I love giving my opinion. Whether you ask for it or not, I love giving my opinion.
Girl, that's the Louisiana girl in me. I was taught that at 3 years old.
You ask me, Caitlin, what's the best specialty? I'm going to say evaluation and management all the way. Let me tell you, family practice, pediatrics, that's where it's at. John is going to say,
Yeah.
but it's again, we're very impressionable. We see, we model what we notice works. So I think a lot of this goes from we're gonna watch and see what worked with us. Like, okay, I like the way that person I like the way that person showed me how to do this. I'm gonna take that.
Mm-hmm.
I remember when I first wanted to go into physician education, I followed our physician educator around on every single provider meeting she would go to, and I would pick up little pieces of how she explained stuff. I liked that. I would take that, and I started creating education for our NP and PA student programs here at the universities. And I would coin, I would take the way she worded stuff, and I would just listen. I think even though we have our certain like areas of subject matter expertise, I love listening to other people talk about Medicare
Oh,
wellness. I love listening to other people talk about evaluation and management,
Mm-hmm.
because I can take that and I like the way that they said that. I'm gonna use that. I might change the way it might change the way I perceive something. So I think learning how to be a mentor is coming to terms with the fact that you do it a lot already. You give guidance to people already. How do you take what you already do and apply it to a professional setting? It's how learning how to say stuff constructively, but giving it a positive spin. This isn't your strong suit, but how what can we do to make this a learning experience? I
Mm-hmm.
think it's learning, it's trial and error. It's learning how to say things. It's learning, okay, maybe this isn't the right, maybe this isn't a very good source for me to use, but I learned from somebody else that I should be recommending this one. So I think it's one of those things. It's ever changing, it's ever growing, and you're going to evolve more as a mentor the more that you do it. I think that's my take on that piece of it.
We finna go.
Well, one more question that I think is important to ask is, so we know that it's clear what the benefits are for the mentee. You're getting the knowledge and those skills to help you be successful in your field. But what are some things a that we can gain from being a mentor um, in this arrangement? Like, what are some things that can be beneficial to the mentor to make it kind of worth their while too?
I don't know about
It,
you guys, but as an educator, as I teach something, it solidifies the understanding for me as well. The more that I would teach something, the more that I would understand it. And I think being a mentor, there's a lot of people who are good at this field, but not everyone can teach, not everyone can lead, and it's important to understand those two things. And I think by mentoring others, you are developing that skill. You are learning a new skill for yourself. It may not be as visible. It's not as tangible as seeing, oh, they're learning how to audit this, they're learning how to code this specific specialty. It's one of those things. It's a rolling. It's a growing, and it never matures, because there's always
Mm-hmm.
more growth in that area. There's always, it's learning about different leadership styles. It's learning how to diversify your education, how you get your content across, and okay, how can I make it so that way people who are visual, auditory, and kinesthetic learners, how can I incorporate all those learning styles and educate that way? I think, again, as far as like a mentoring, I don't think it's not as visible as what we're teaching someone else, but it's a growing skill, and the more that we use it, the stronger it gets.
Absolutely. And I will second that because I'm glad you said that too, Caitlin. Because another thing is the more I teach something, the better I get at it because I get all different people from all different walks of life with all different levels of understanding and communication, right? So because I taught it to Babette one way and she got it, I may have to change up the way I teach it to Barbara because she may not get it the way Babette got. And that I think makes me better. It makes me better as a mentor. It makes me better as an instructor. It just makes me better even in communicating just at chapter meetings because you learn how to adjust based on your audience and the person that you're communicating with. And I think that in itself is a strength, right? It's a strength for you as a mentor. And me, even now, I'm a mentee. There are times I'm still a mentee. I mentor people, but I'm still a mentee. There are people that I'm learning from every single day. I tell I'm lifetime learners. I just got in compliance. What, in 2020? There's so much to learn. I am a mentee when it comes to that, and so um, I think the roles are exchangeable all the time. And the more you're exposed, the more you set yourself out there to adapt. It's going to continue to grow you.
I think it helps
I
our confidence
think,
too,
yeah,
by doing that. Sorry, Barbara.
I'm excited. Yeah, I'm sorry. I'm just excited to work in this industry. I've worked in no other industry, and where I started at to where I'm at now, and the fact that I'm working as hard as I did before, it's crazy. I never thought it would be like this. So I'm excited. I love it. I love it when someone is new or wants to ask about it. I'm like, "Oh yeah, sure. Let's do it. What do you want to do?" And so that's how I am. It's like, okay, you want us to do this? Okay. All right, let's do it. And that's just me.
Yeah,
But
me
I
too. I
think,
love the challenge, right?
yeah,
It's like,
I think
bring it
I
on.
think
I'm gonna get it.
yeah, and I agree with Kimberly on teaching because even though I'm in CDI, I do provider education. Sometimes I have a provider that, is not real fluent with the guidelines, could care less what the guidelines are, and sometimes they're having a bad day. They're 3 months from retiring and they're just going to give it to me. Like I had one the other day that I was going over our chart audit specific on risk adjustment coding. And then his first thing was, why didn't you come to my office January 1st to talk about this new code G22.11? And I think, John, you and we were on, I think, Betty Hovey's show. And I had just had an hour of this doctor who was giving it to me. And so I listened. That, like we talked about, I listened to what he said. And I said, yes, sir. I said, I have actually reached out to your practice to do a review of the internal chart review. And I said, I certainly can discuss G22.11 with you. And that's why I think, as we are with coders, auditors, whatever your role is, that you keep your skill sets. Because even though I might focus on ICD-10 codes on one job, next month, I might be over here where CPT is just as important, or I'm focusing on revenue. And I'm so glad that I keep up on it because I was able to table that G22.11, and then the email that came afterwards saying what he did. And then I was like, okay, I'm good. So I thought, why don't I make a presentation on G22.11? I've spent a lot of time on it. I had someone, throw me out the door and bring me back in. And then he talked to someone else and said, oh, by the way, I told Dr. So-and-so. But that's the kind of things we find that come across our way as mentors.
How about you, Babette?
I think, for me, like Kimberly said too, when you're doing certain things, I learned that visually, if I'm doing a presentation and I do visual, I get more from visual cues sometimes, where if you have a lot of blank faces or half blank faces and half people are like, oh, yes, I'm getting it, you have to shift really quickly. But those are things you can also learn when you are a mentor, that, okay, I know what worked and what didn't work, but that also helps your own confidence. But, there are a lot of things that I learned over the years, is just things, my communication style, things I should work on to change for myself as far as that goes. But all those things keep you growing and learning, like, as Kimberly said, being a lifetime learner, and you network and have a ton of connections. So I think Barbara said this, or maybe Caitlin during the conversation tonight, is that, you have this huge network, and if you come across something, you're like, I know at least 2 people I can ask this question to. So it's very valuable. So, it's a great way to continue learning. And I like to be a mentor. It's just time.
Yes,
You
I know, right?
got to make sure you have that time.
Yes, so many hours. That's what I tell people. But you know what? I'm honest about that, Babette. I had someone just come up to me, and it was so funny. They go to church with me, and so they sent me an email. Bad me, I didn't respond. They saw me at church Sunday, so they came up to me, but I did acknowledge. I said, you know what? I saw your email, but I was trying to wrap my mind around when I could make myself available to help you. I said, I need you to send me another email telling me exactly what you need so I know how much time I need to try to set aside if I'm going to be able to do this for you, because I don't want to set it up and then the next thing you know I say I can help and then life happened and I don't have any time to help them, right? And so
Right.
I'm real transparent and honest about it.
One of the things that I've seen is that, from being a mentor, you're learning, like Caitlin and Kimberly said, like you learn a lot more about coding doing it. But one of the things that I find specifically is that when you're telling somebody how to do something, it makes you pay more attention to why you're telling them that information. Like, well, why did I just tell them they have to code this way? Because there's guidelines. Well, let me make sure I fully understand those guidelines. Make sure I know where to find them. So, like, it makes you think, okay, if I'm telling somebody to do something, I want to
Oh
make sure
yeah.
I'm correct. And that makes you a better coder because now you're bolstering your ability uh, in a more technical way. So I
Mhm.
think that's an added benefit to mentoring somebody. You're changing your thinking process, your thought process, because you have to make sure that you can back up what you say with evidence.
Oh yes, and I'm telling you, even as something as simple as when you're first teaching medical coding or medical billing and you have to show someone how to find something in the index. Even me, I've opened up my book, right? Okay, I figured out how to get to this diagnosis. Let me open my book and word for word make sure I'm telling them correct, because I've learned that I think, oh, you go here, you go there, look this up, and sure enough they'll look it up and they'll be like, it's not there. I'll go back and look, and it's like it's not there. So now, like I said, in making me a better person, I don't just shoot it out there and say, oh, go look up this word and go look up history and you'll find it right under history. No, I open up the book and now I walk it myself to make sure that the instructions that I'm giving to someone is the right instructions. So yes, it does make you a better at everything.
Yeah. All
I
right, so
think we got a lot of experience with that whenever we write when we write exams, because we have to write the
Yes.
rationale behind how we find the answer.
Yes.
I
Yeah.
had to learn that, and I was like,
Yeah.
but this
We
is
help
common.
each other a lot with that, right?
Why do I have to write it this way? And it's like,
Yes.
well,
Yeah.
it's common sense to me because I've been doing it. But
Yeah. Writing those exam questions will make you better as well.
yeah, well, because you don't want
yeah,
them to argue those questions, and I know for a fact that like one of the last things, like from any of my experiences, like you don't want that question taken off the exam because it wasn't accurate
Well,
or
yeah, and you don't want to do that to someone, because I think about when I'm an examinee, right? The worst thing you want as an examinee is to read a question and you're like, well, none of these answers make sense, or is that right? Or did they transpose the numbers? I look up that CPT, that's not even the right CPT code, they transpose the numbers. I would never want that for myself. So it makes me more condescending to make sure don't do that to someone else. Check yourself. Make sure you're given accurate information.
yeah.
right.
So true facts from the '90s. Check yourself before.
You
You
wreck
ready?
You
yourself.
wreck yourself. Oh,
Fact check, fact
you
check.
just revealed me.
You know what makes me laugh with that is my oldest daughter, when she was a teenager in the 90s, would go around saying that constantly. And I would always have to say, enough. And she would say it all the time. Oh, too
Yeah,
funny,
I'm a
John.
'90s baby, so that was
yeah.
I learned a little bit after.
Oh,
All right, so we're gonna do one more core based question, and then open for comments. But if anybody in the chat has a question they want to pose before we kind of break, now's a good time to put them in the chat. So, in the period waiting to find a mentor, what can you do to kind of guide yourself along the way? Like until you form a mentorship arrangement, what are some things someone can do to help improve without a mentor?
Network.
And I would say be proactive. You want to be proactive and not reactive. So have you went to the website of what you're looking into? You say you want your CCS. Have you gone to HEMA? Have you read what's required for a CCS? Have you gone to Indeed? Is that credential? This is the one thing too. Another pet peeve, Kimberly, as an instructor. I have different people come to me and they're like, oh, I got a credential from Jack of the Trade Medical Coding. It's a CPICACBC. I never even heard of that credential. I'm like, did you go and research that credential to see if people are hiring people with that before you invested that money in getting it? Make sure you do that. Don't invest financially in something and you don't even know if it's marketable and if you can steal yourself a job in it. So I say, do your homework, be proactive. Go look at that website. Go to Indeed and Monster. Who's hiring for that? Is that a company you want to work for? You know, can you market yourself? Will you be able to sell yourself? What are you needing from a mentor while you're waiting? Make your list, right? Because, you know, even when I go to the doctor with me or my mom, now I'm getting, oh, I turned 50. I got to write everything down. By the time I get to the doctor and we start talking, it's like, oh, I had 4 more questions. What were they? I don't do that anymore. I put them in my phone as soon as I think of them. And then when I go to the office, I pull them right up. Make yourself a list of questions because when you get with that mentor and that mentee situation, depending on how that dialogue go, you'll forget to ask your key questions. So I say just be proactive, do those initial steps. And while you're waiting, that way, when you get with your mentor or you get as a mentee, you'll be prepared.
Anyone else?
I want to say network because that's going to be the best way for you to find someone who can mentor you is to network with people who are again who have been where you want to go. You can look up people based on job titles. If you want to research a specific specialty, if you do a hashtag that specialty, you can click on that hashtag and it will show you recent posts with that hashtag. So you can find people who are talking about the content that you want, and then you can find the people who have information on that topic. Like if I'm talking about something coding related, I typically put like hashtag CPC because that's my credential. That's the credential that tests that specific competency. So I would look for again, find those people who have been where you want to go because that's how you're going to find your mentors and network and look up. And again, like Kimberly said, look up that information, understand what you're getting yourself into. That way you're better prepared for someone who's like, okay, this is what you need to do. Okay, I'm ready to hit that ground running. I was prepared for this. I know what I need to do, and then run with it.
How about you, Babette, or you, Barbara? Anything added to that about what people can do in the meantime while they're waiting?
I agree with Kimberly and Caitlin's great advice. And the only other thing I would say is if you are waiting too long, there's so many tools out there online now. I mean, you can look at so much, and there's a lot of free stuff that you could start to, dig into the stuff that you want online, and you could get a little bit ahead while you're waiting because sometimes it can take a while to be able to get a mentor.
I didn't have a mentor in the field. I navigated this field by myself, and I can say from being in that position, it's exhausting, it's scary, it's all of the things, it's all of the emotions, and you have to want it. If you don't until you get that mentor, if you're going to succeed further, you have to want it. You have to want to do better. You have to want to be successful in the career because I can't, even if I am your mentor and I can want that so much for you, if you don't want it, it's done. So you have to want it. You have to put that work in and do it.
Yeah. I used to always say, I can't want it more for you than you want it for yourself, right? Yeah, because no matter what I do, if you don't want it for yourself, it's like taking the CPC exam. I can't take it for you. I can prepare you, I can give you the content, I can go over it with you, but you got to do the foundational work to make yourself prepared to pass that exam. I can't go with you. You got to want it more for you than we want it for you.
And I like to add that you need to know what your weaknesses are. Identify your weaknesses, because that's what we're focusing on. Kind of like part of the plan. So like everybody has weaknesses. Like for example, I'm short. I'm like 2'36". So like I can't do much about that, but I can try. So like there's always something.
Is that a dig on short people, John? I might take offense to that.
But knowing what you want to resolve, like for example, when I believe it or not, and I don't talk about this very often, but I have a really bad stutter. Like I used to be fearful of speaking in public, being on camera, talking to people in kind of any situation, like really freaked me out. But I've gotten over it because I found that talking about coding and the confidence that I have in it, I don't stutter. But it's a weakness. Like if you want me to talk about, like, I don't know, like fixing a toilet or something, I'm like, yeah, I don't know where to begin. But it's a weakness. So like again, there's things that we can fix, and there's things we can't fix. But being able to identify the weaknesses that are something that we can fix, and focusing on this is what I want to correct, and this is what I want to improve upon. That's something you should have ready for when that mentorship begins. Letting them know right off the bat, by the way, I do have a speech problem, or I'm only 5 feet tall, just so you know.
You won't see me on camera.
No.
I'm sitting on 2 phone books.
I'm very honest. I mean, that whole transparent thing, I'm very, that's just how I am. I'll, if someone says, hey, I'm looking for someone to help me with this, and if that is not my niche, I'll say, that's not me, but I can tell you, I can give you some people that can potentially help you, but I am not going to say I can help with that, and I cannot. I would never do that.
Too. That's me too.
And I'm Caitlin, and Caitlin, just like you, I had no mentor or whatever all those many years ago when I started in this, and never ever thought that I would stick with it and grow into the way that I have. So it's amazing what's in this career field. And what I really love is how there's so many different types of jobs that we have now than what we had back in the day when I started off, with the pegboards and the Rolodexes. Oh yeah, that's when I started. I mean, I remember when I was one of the practices when we got a computer system, it was like, whoa. And then I remember going from one computer system to another computer system. I thought I was it. I was like, oh my gosh, I'm the first person to do this. This is really phenomenal. And oh yeah, but no, it's amazing what we have available and the different types of jobs in our career field.
And you don't want to be that person that say you can do something and then the person find out you cannot, right? That's all about your character, your integrity. They won't ever come back to you again. So I'm a big proponent about that too. I'm like you, Barbara. It's like, that is not my wheelhouse. Let me give you 2 or 3 people who I think can help you, and I will gladly say, nope, I don't do that one.
I just had a lady on Friday send me something in my inbox, and someone told her that I was an SME on this certain abdominal surgery. The procedure, I can't remember the name of it right yet. It escapes me right now. And I said, I greatly appreciate you, sending me the message. Unfortunately, I am not an SME on this, but you can contact this person and this person because I know they code that type and they audit that. And I said, again, I apologize. It's nice to connect with you. If there's ever another question or something that I can help you with, please reach out. I may even reach out to you. And that's how I left it.
That's right. Yeah.
Important question. What's a Rolodex?
All right.
You weren't even born back then.
So little. Okay.
I'm sure my children are older than you, Caitlin, so it's okay.
I think
I'm like, Caitlin, what?
Okay, I'm
gonna Google it.
I'm gonna send you a picture of one. Okay, love.
Yes.
Okay, so you
Yeah,
are
we had
Rolodex.
we had pegboards, ledger cards, Rolodexes. That's how we worked the front desk.
Like a
You
You
push
know,
know,
board.
you can't even fathom it, Caitlin. So it's a little, they have little 3x5 or smaller cards on it, right? And we used to put our addresses and the name and the phone number, and you had A through Z, and you stick the card in. Yeah, you
it
can't
was
even.
almost like a
And
little index card that
you
went
could
around this
twist
little
it.
round thing. Yeah.
That sounds fun though. Like my ADHD would just like love it. Like,
Yeah.
sorry, like I'm supposed to be listening to you, but I'm sorry.
Yeah, or they did used to come in a nice box. You're right. Then you could get a little black box where they would put the A through Z in there, and it's a little small little box 3x3, and you put all your addresses in there. Yeah, poor thing, she don't know a Rolodex.
All right, well, we do
It's
have
all right.
one question from the audience, so I'm going to put it on here. So, Christy Hunter wants to know, what is the best way to professionally approach someone to ask for mentorship? I say flowers, but that's just me.
Don't
Yeah.
give me
You
flowers.
know,
I don't like flowers.
I take
I
crumble
think
cookies.
the best, you know, first they wrote it eloquently. You know, they're going to, you know, approach it in a professional manner, which is wonderful, because they're being that intentional with what they're wanting. So if you're studying for your CPC, if you're studying for a specialty credential, or you're wanting help to find a role in a specific role, my thing is find that person that you know, like we said, we can do the hashtag things, find people that is, you know, whether you're looking for an instructor, you know, someone who is great with auditing or whatever that, or a revenue analyst, whatever it is, reach out to that person and ask them if, you know, they would like to you know, do this relationship for this role. And that person is, you know, should be, you know, honest to say yes or no, or I can start it next month or something like that. And that's what I would do.
I think how I would approach it is depending on how I met the person. Like a lot of us are meeting people virtually right now, so that would, to me, that's just sending a message and making sure the intent is clear. Hi, my name is so and so. This is what I'm currently doing. I'm looking for mentorship or guidance on XYZ. Are you interested in looking into this relationship further? That's how I would approach it from a virtual standpoint. If you're meeting them at like a chapter event or a conference of some sort, it would be appropriate for you to approach that person. So I like putting faces. I like putting faces to names. So if you come to me and say, hey, Caitlin, it's so nice to meet you. I'm looking for mentorship on professional speaking. Would you be willing to help me, figure out what topics I would be best at talking on? How do I approach how I approach my discussion, the way I carry my content. That's what I would be looking for. I would be looking for someone who is, hey, just a basic greeting. Hey, nice to meet you. I need mentorship on this. Are you interested in exploring this relationship? And that's where we can look into, okay, do we, that's after that, that's when you get into those, the scheduling and the boundaries and how often and all that good stuff. But depending on how you meet that person, I think is going to kind of dictate how you approach them. I personally, I take crumble cookies. So if you come with me to a cookie, I'm going to say yes.
Like, and I'm not picky. I'll take any dessert in the Louisiana dish.
How many cake pops, Kimberly?
Yep.
I
Anything
got
you
you.
give me. Like, I'm not picky. But yes, I do say, and know what I say, communicate too in the best way that you can get your point across. Because again, if you're not a person that does good emails and you think your email is going to be totally off and not clear, pick up the phone. Send them a call. If you're a person that prefer text, send them a text. I say whatever method you can get your point across to set that great goal and expectation that the mentor is going to know what they need to help you with. I say use any method. It's 2024. We have choices, right? We have a variety of choices of communication. So I say whatever one will make you the best at getting your point across, that's the method you use.
And I wanna voice this from our chat. Not all the comments do transfer over to our platform, but somebody in chat by the name of Camilla Boyd, CPC, CPB, COC, CPMA, she said, "My advice: don't be afraid to reach out. You
Mhm.
won't know if you don't
That's
ask."
right.
That's
That's
right.
right.
I like that.
That's right. You have to ask. Yes, don't be afraid.
All right. So, any last minute comments or things that I might not have covered that would be kind of relevant to the conversation that you want to add in, like as a last minute response to?
I
I'm
just
gonna
say
say
believe in yourself. Believe in yourself. Don't be afraid. Believe in yourself. You are your biggest champion. Don't let anybody take that power away from you.
anytime you're getting into a mentor-mentee relationship, if you are the mentee, start off with why you want something. It's easy to start say what you want, and sometimes you can figure out how you're going to do it. But if it doesn't align with why you want to do it, you're not going to be fulfilled by the end of it. So think long and hard before you go through the time and the work, and maybe even the financial aspect of paying, going into that, fully investing. Make sure it aligns with the goals of what you have for yourself, for your career. It aligns with your values. Start there, and then everything else will fall into place.
Totally agree with that.
I do too.
Yes, me too.
So, can we try this as a community? If you are a mentee or a mentor and you are looking for somebody, and you are a mentor trying to find a mentee, or you're a mentee trying to find a mentor, can we put this on our LinkedIn profile? And I don't know exactly where it is. Maybe somebody on here can kind of correct me as we go along, but can we put this hashtag mentor or hashtag mentor? Like if you're a mentor for, say, I don't know, orthopedics, put mentor and you're open for that and you're willing to take on a mentee. Can we put this in on your Facebook page? If you're a mentee and you're looking for somebody, can you put mentee underscore whatever you're looking for? There's a way to identify, like if somebody's searching for you, you're going to come up. I don't even know that's even possible. Is that technically possible on like on LinkedIn? Can they search for hashtags, or can they like look for somebody like that?
Yeah, the special characters might throw it off. So I would suggest not using like the underscore or anything. I would do hashtag mentee orthopedics, mentee mentor compliance. That's because, like I said, because once you hit those breaks, it breaks up the hashtag.
Oh, okay. So like something like this. So
Yes.
yeah, if you're a mentee looking for somebody, just casually put this in your somewhere on your profile, and keep it until you need to remove it. And if you're a mentor, do the same thing. Put it in here with mentor and whatever you're able to mentor somebody in. For example, somebody like me would put in cardiology, or uh, possibly Barbara would put in CDI or something like similar to that. And that way, if you are unable to take on any more mentors, you just have to take it off of your profile. But it's a good way for somebody to identify you, or to find you. And I want to add that if you feel confident, and there's a lot of confident coders out there, and a lot of them do have podcasts and write articles and already currently mentor people and do a lot. But if you're a coder that feels fairly confident in your skills, the industry needs you. Like I'm recruiting like I'm Uncle Sam. You know, AAPC needs you, kind of thing. So, or AHEMA, because there's a lot of coders out there that are just looking for that helping boost up. And it's like that. I don't want to say pay it forward, but like be the person you wish you had when you were.
Mhm.
Because there's a lot of people out there that really are struggling to get through
Mhm.
this, and I think if we step in and do this, I mean, it's just going to give marvelous results. And I think as a community, why wouldn't you?
I always say that the reason I go into mentorship is because I'm trying to be the person that I didn't have.
Mhm.
So that's
Mhm.
that's my goal. I'm trying to help someone who could have helped me. So if I can be that for you, please feel free to reach out. If I don't know how to help you, I'm sure one of us knows somebody. So we're, for me, this is an open invitation. If there's anything that I can help you with, please feel free to message me.
Agree.
All
I
right,
may not know what a Rolodex is, but I can help find people.
You're gonna know today. I'm gonna send you that picture.
all right, we've been on here for an hour and 45 minutes.
Oh wow.
A tremendous discussion. And anybody out there, feel free to share this. I'm sure we're all okay with us being shared, and because I think this is a very useful topic. And I know I've done a lot of episodes related to more specific things, but I think this is going to be helpful overall to almost everybody. So if you have any open discussion that you want to have about mentorship, I highly recommend you put something on LinkedIn. You put yourself out there as a mentor, put yourself out there as a mentee, because I think, as a whole, the community needs it. Like, we are kind of the financial backbone and ethical background, or backbone of the medical field. So I think it's best that we all have an adequate level of confidence in our skills, and to do that, sometimes we do need mentors.
Yes, yes. And for all of us, it's an honor to serve, right? That's why we're here. We always want to pay it forward. So
Definitely.
All right. Well, if there's nothing
Yes,
else, I'd like to
because one day I'm going to retire.
Not allowed. Big toad.
yes, and we want this to go on, right? We want to have
Yes.
people out there where you can one day fast forward and you be the person on here doing this same promotion, same encouragement, cheerleading and mentoring, right? So we gotta pass the torch, pay it forward so it can continue.
Exactly.
I just need to know that I can still call you guys even after you retire, because y'all will retire before I do. So I just need to know that I can still call you. So
Of course
Good
you
I,
can.
practice
ho-
down,
I
Kate.
hope I get to retire before you. But definitely. I think it's going to, it'll be really interesting, because I've done this, like I said, 39 years, and it's like, will I ever stop? Because I'll tell you, there's a couple of chapters. One asked me to present at May Mania, and this lady is in her early 70s. Now she's fully retired from her job, but she still helps with her chapter.
Oh yes.
And you know what I said to her? I said, I think it's phenomenal that you still help your chapter as much as you do. I said, that's what needs to be, acknowledged, is what you do for this chapter.
I hope that's my story. The 70-year-old officer still working, right? I love it. I love working for the local chapters. It's so rewarding.
Yeah.
All right. Well, I've kept us all here way too long, and I do want to thank Caitlin and Babette and Kimberly and Barbara for helping with the discussion. I think this is something that we could continue in the near future, because I think there's still more to talk about.
Yeah.
So again, we like to thank them for coming on, and reach out. We're all available on LinkedIn. I don't want to speak it for everybody, but
Yes.
I kind of just did.
Connect. Yes, and happy Palm Sunday, everybody.
Yes.
Yes.
We'll have a good night. We do have one episode on the horizon, hematology and oncology, and that's coming up in about 2 weeks. I'm taking off next week for what's going on next week?
Easter
Easter.
Sunday.
Easter.
Yeah, but the following week we'll be back on our normal Monday schedule for an episode on hematology and oncology. Have a good night, y'all.
Wonderful.
Bye.
Bye.
Thanks, John, for all that you do.
Yes.
Thank you
John.
so much.
Great. You're doing a phenomenal job.
Bye.